And we're live. Welcome back, everyone. Craig here, the Resourceful Catholic Man. Um, wow, two videos in a row in back-to-back days. I had a few minutes, and I was thinking about something. It's actually a video I've been wanting to do for a little while, and I was actually working on this issue this morning. So I thought, you know what? Let's just go ahead and grip it and rip it. And I'll put out a short video on the topic of health insurance, healthcare, and how to navigate that, especially for Catholic husbands and fathers and wives. Um, so, in the U.S. at least, healthcare is a challenge. It's an important thing. Healthcare is expensive, um, and paying for it can be difficult. And for most of us, at some point in time, we go in search of health insurance, oftentimes provided by employment, although not always. And access to health insurance and continuation of health insurance can be a real critical factor in how people live, whether they move, what kind of jobs they take. And it can be, it could feel overwhelming at times. And at times you can sort of feel trapped in a work environment because of this issue. And so I wanted to talk a little bit about it. Now, as a disclaimer and as in full disclosure, I'm going to get maybe a little bit political here, but bear with me. So, obviously, in the US, we don't have state funded health care, although we have Medicaid and I guess Medicare for people that are disabled and over a certain age. But for families and stuff, it there is in most states, depending on which state you're in, there's going to be state assistance of some sort funded by the US, I think, Medicaid system. And different states have different names for it. Different states have different levels of funding and requirements and things like that. Probably the um, broadest eligibility tends to be for children. So I think in most states, um, financial qualifications, of course, but I think the re- eligibility standards are pretty broad that a lot of people, if you don't have health insurance provided through work or something like that, are eligible for Medicaid. And I would say the next tier is probably pregnant women, prenatal care, especially if you're a single mom or something like that. I would say in a lot of states, people that are women are going to be eligible for state subsidized prenatal care because what are you going to do? The hospitals are not going to turn pregnant women away, especially when they're giving birth. Um, and then maybe the third tier is going to be, let's see, um, working age men that are, capable of working, probably have the most difficult time qualifying for state assistance. Now, and this is where I'm going to get a little bit political here because this is a, podcast by Catholics for Catholics. And I just want to talk about a little bit about the elephant in the room here. Now, I'm not here to make judgments about anyone, but I want to point out a reality that I think a lot of people are not aware of, especially priests, is I think a lot of, let's say, larger Catholic families, especially, let's say, Catholic families where one spouse, typically mom, stays at home with the kids. And unless dad has a pretty good job with health insurance, or even if he has access to health insurance, once you have a certain number of kids, more than let's say a couple, um, it's pretty easy to qualify financially for state um, Medicaid assistance, even if it's a sort of augmenting your health insurance that you might get for work. Even health insurance plans, policies that you get through work are going to have, for the most part, have pretty significant deductibles, copays, out of pockets. And so someone can actually be have health insurance and also be financially eligible for Medicaid to come in and pay those out of pockets and stuff like that. And also for those that don't have access to health insurance at all, it can actually be very easy for large Catholic families, and large not in the, let's say, from the standpoint of most Catholic families, but large in terms of society, which has less than 2 kids on average. So I think anytime you get into 3 kids or more, you're considered large by society standpoint. Um, and I believe that there are a lot of, let's say, large Catholic families, typically traditional, who are eligible for and receiving um, sometimes generous state assistance, whether it's healthcare, dental care, food, other benefits. And again, I'm not here to judge anyone for that. I'm really just pointing out the reality of it. And in particular, I think it's something that needs to be factored in when we're assessing people's decisions to have children or space children and things like that. Um, my position, and I'm this is just my opinion, it may not be worth anything at all, is I don't think, how do I say this? I don't think Catholics are morally obligated to go on state assistance, and I don't think that the eligibility of availability of state assistance for health care is eliminates, let's say, or gives, how do I say it? Let me start over. I think a couple can have good cause under, let's say, Humanae Vitae to space children, even if they would be eligible for um, public assistance for the cost of that child. And in fact, I've seen arguments made by, especially by traditionalists, that couples don't have a good cause to avoid having children if they're going to be eligible for state assistance and things like that. I personally disagree with that, but I'm not a theologian. But I think on a practical level, I think we as Catholics ought to take more seriously responsible parenthood and um, not necessarily take all public assistance, even if we're technically eligible, especially if it is a byproduct of choices that we have made in terms of how to live our life, how many children to have, things like that. But I know from experience, and this has been a cause of frustration in my household because, not that I'm better than anyone else, but I have, um, on a philosophical level, I have chosen not to partake in those benefits other than when we were first married and I was in school. But I have, as a philosophical matter, thought it was inappropriate for us to take advantage of those, even though I knew I know once we had a certain number of kids and I was still kind of low man at my job, that I know we would have qualified, but it it felt wrong in my mind to make use of those benefits when we could afford the life, or we should be able to afford the life and the responsibilities we had chosen, in part because as Catholics we were having, being more open to life. So anyway, that's as far as I want to go there. Again, I'm not here to judge anyone, although I would like encourage people to maybe give this some thought. And but but I want to offer some alternatives here, okay? Because health insurance is very expensive. I know this because now I'm an owner in my business, and we provide health insurance, pretty good health insurance to our employees at a very high cost, to the point where I personally do not purchase the health insurance that our company uses because I would have to pay that entirely out of my pocket. And it is, I think it's close to $2,000 a month for a family plan right now, maybe a little more, and not exceptional coverage, still decent copays and out of pockets and stuff like that. Um, so I guess I guess what I'm saying is I personally can't afford or don't afford the health insurance that I purchase for my employees. Um, And what we have done, and I've actually been very happy with it, probably for the last 5, 6 years, have gone to a what's called a Christian or religious health share, which are, I think to put it simply, are exempt from the Obamacare requirements that mandate certain types of coverages. I think most notably being pre-existing conditions. That was probably the biggest element of the Obamacare, was to require health insurance carriers to accept pre-existing conditions, which sounds great in theory, but adds a significant um, cost. It significantly adds to the um, liabilities that a health insurance company is taking on for a new person that may not be with them indefinitely, right? I mean, if this was a lifetime relationship, that's one thing, but you know, person could come in, they have significant health issues, and let's say they need a surgery, and the health insurance company pays the surgery, and then 2 months later, 6 months later, they're off the plan. The health insurance company can't really recoup that. So the big factor in Obamacare was the requirement that there be coverage for pre-existing conditions, which required insurance companies to greatly increase premiums to try to absorb and spread out those kinds of costs. And I'm not here to debate the merits of that, other than to point out the fairly significant financial consequences of that, which incidentally is one of the main reasons why I stopped um, obtaining insurance through my own business's plan, because it greatly increased our rates. And we then went to a health share company. If anyone is interested in the name of the company, just reach out to me. Um, and we were young and healthy at that time. We probably had 7 kids, but um, so we were willing to accept the fact that they would not cover pre-existing conditions, and it it is an alternative to health insurance. It doesn't actually work as health insurance. You're considered um, a cash payer to the hospitals and clinics that you see, but the health share kind of reimburses you or pays them after the fact, and they are very good at negotiating rates down. Because one thing, if you don't know, there's a big difference between the quote unquote billed or charged amount for healthcare services and how much is actually paid most of the time, especially if payment is made by either health insurance or Medicare, Medicaid, things like that. There's significant discounts there that are either negotiated in terms of health insurance plans or forced upon them when it comes to like Medicare and Medicaid. And so they try to absorb or recoup some of that money in other places, most notably private payers, cash payers. Um, and so, but the way health share works is you go in, you say I'm basically uninsured, and then charge me, or sometimes you can work out a payment plan in advance. Different hospitals and clinics have different approaches and are different cultures in terms of whether they're receptive to this or not. And I'll get to the point of that here in a second in my own situation. But um, so you essentially become a quote unquote uninsured cash payer, which generally speaking entitles you to a pretty significant discount as it is, because they understand most people don't have a bunch of money sitting around their bank account. And then the folks at the health share have people that are very trained and well tuned to um, scrutinize bills, work with hospitals, clinics, sometimes shop around, find better alternatives, more affordable alternatives. And we've been very, very happy with that. There is a learning curve to that, but we ended up, so we went from, let's say, health insurance at my business from, let's say, I think at the time we were paying around $1,500 to $1,700 a month, to I think we started out at 500 a month. Now it's more than that, but so is the health insurance that we have. And so we went from 1,500 a month to 500 a month with actually better coverage. And almost no restrictions on where we went. Whereas on the plan that we have for my business, um, there's provider networks. You have to go to this hospital and clinic. You can't go to that one unless there's a referral and all that kind of stuff. So we actually got access to pretty much anywhere we wanted to go for less amount. And yeah, we paid a lot less per year. The only thing being is there's a bit of a learning curve, and sometimes you will get hassled by hospitals and clinics because they may not provide expensive care to you without money up front. So that's actually what I dealt with last year when I was having my heart issues. I went to the hospital or clinic that I wanted to, the one think I still think is probably the better, the more what do I say, prestigious of the institutions in our area, but they were completely unworkable. Wanted huge amount of money right up front, and ended up shifting my care to the other place in town, which I think has somewhat surprisingly, a much more empathetic approach to people, and was very willing to work with our health share company and provide estimates up front, very transparent about the cost, very um, flexible, I guess, in terms of working out payment plans and things like that. So this morning, the long story short is, I ended up going to the other hospital that I at first didn't want to, and I've had a very, very good experience there. And my health share has been very, very good. They've been very willing to work with us. And the only thing it really requires me to do is to get my medical records and full bills with all the codes. I was actually working on that this morning and updating supplement. What do I say? Uploading it to our health share portal, and then they kind of take it from there, and they work with the hospital and clinic, the billing department, to try to negotiate it down. So um, I want to offer that this is a in a particular for people that, let's say, may want to consider starting your own business or become entrepreneurs. Um, the cost of health insurance, especially if you're trying to buy into the market, can be extremely expensive if you can get it at all, and um, very restrictive in the options you have for getting health care. And so I want to really encourage you, if you've never looked into a health share. Now, as I mentioned, probably the biggest thing that you have to be aware of is they will not cover, probably won't cover pre-existing conditions. Now, maybe you can get coverage for everything but that, and maybe then you're eligible for some state assistance just to cover that issue. I don't know how that works, but um, I think for a lot of people that are reasonably healthy, young families, a health share can provide a very, very good alternative to health insurance, especially if you're not happy in your job or you want to be able to move around during the middle of a pregnancy or something like that. Maybe consider a health share. There's a number of them out there. If you put a message out on Facebook and your friends, I imagine you'll have someone in there that has experience with it. And like I said, if you're interested in the one that we use, it is not a Catholic one; it is a Christian one. I think most of them are, because I think part of the Obamacare exemption requirements is it has to maybe be kind of in a religious affiliation. So you have to, like, when you apply, basically sign an application verifying that you're a practicing Christian or something like that. It's not difficult. Um, but if you're interested in what we do, I'd be happy to share that with you. I believe right now for a family, our family, a large family, I think we're paying around 800, 700, $800 a month for it, which, you know, is not pocket change, but it's definitely under half of what I would pay for, I would say, less quality insurance under my own business's plan. So something to keep in mind. Wanted to throw that out there, especially for people that don't get yourself locked into staying at a job or in a place because of health insurance. Realize that there are other alternatives out there that you may not be aware of, and I just want to make that known to people and encourage people to look into that. And if you have any questions, like I said, go ahead and reach out to me or leave a comment. I'll be happy to try and help you with that. So anyway, that's all I have. Want to leave that with you guys. I appreciate you listening to my videos, commenting and things like that. And if you have questions or suggestions for other videos that you think you might like to hear me discuss, just leave a comment or get a hold of me and I'll see if I can help you out there. So anyway, appreciate everyone for watching. And until next time, everyone, have a good one.